Out of the 10 most popular supplements, 4 are a complete waste of your money, and a couple are downright harmful. But there are some worth taking. Let's start our journey with the 10th most popular supplement, vitamin B12. And there are a couple of crucial conclusions here. Vitamin B12 is required for the development, myelination, and function of the central nervous system. It is needed for healthy red blood cell formation and DNA synthesis. When referring to intakes of vitamins and minerals, we have adequate intake, which is the minimum required to make sure you do not develop deficiency symptoms. But that is not what we are really interested in. We want the best, which is the recommended daily intake. And for vitamin B12, that is 2.4 micrograms every day. That is the first important point. There is a significant difference between adequate intake and the recommended daily intake. B12 is present in foods of animal origin, including fish, meat, poultry, eggs, and dairy products. And there are some people who suffer from vitamin B12 deficiency. For example, they might not eat foods containing vitamin B12, or they have a problem absorbing B12 from food. They may have had surgery on the gastrointestinal tract. And certain medications, such as metformin or proton pump inhibitors, can affect B12 absorption. So, for older adults who struggle to absorb vitamin B12, or for people who do not eat meat, they might benefit from vitamin B12 supplementation to reach the recommended daily intake, particularly because even at large doses, vitamin B12 is generally considered safe because the body does not store excess amounts. So, while most people do not need vitamin B12 supplements, there is a group of people who genuinely would benefit. And that is the second important point. Reaching your recommended daily intake of micronutrients is important. And for some people, depending on their health and their diet, they may need specific supplements to do that. Before we continue, I am Dr. Nyra Harrison. I specialize in senior health and preventive wellness. And my commitment throughout this video is the same as always. Plain language, real research, and honest conclusions, so you can make informed decisions about what goes into your body. Subscribe right now and turn on the bell. I share content like this every single week. And drop a comment below, which supplements are you currently taking every day? I read every single one. Number 9 on the list is curcumin, also known as turmeric. And this one is important to personalize. Turmeric, or curcumin, is promoted as a dietary supplement for a variety of conditions, including arthritis, digestive disorders, respiratory infections, allergies, liver disease, depression, and many others. It has a variety of interesting biological properties. But it can be often difficult to study these compounds because they are unstable, meaning they change into other substances quickly, and they have low bioavailability, meaning not much of what you consume actually reaches your bloodstream. However, a large study published last year looked at patients with arthritis and found good evidence that curcumin improved pain levels for patients suffering from osteoarthritis. So for patients who are struggling with osteoarthritis and want to explore supplements, curcumin is worth discussing with your doctor, particularly when paired with a compound called piperine that improves its bioavailability significantly. But outside of that one indication, the research picture is far less encouraging. A massive 2019 meta-analysis combining 19 separate randomized controlled trials looking at overall inflammation found that curcumin did not improve inflammation compared to placebo. There is no convincing evidence for improvements in Alzheimer's disease, heart disease, or diabetes. And animal lifespan studies from the Interventions Testing Program showed no benefit from curcumin supplementation. So, outside of using it for osteoarthritis, the current research suggests that curcumin is a waste. Now it is your health and your decision. You are free to buy whatever supplement you want. I am just here to deliver the research so you can make your own informed decision. But, in my view, that is the first out of the 4 wasteful supplements on this top 10 list for otherwise healthy people. And we have not even reached the harmful ones yet. So, the next supplement on the list is zinc. Zinc is an essential mineral. It is involved in many aspects of cellular metabolism and is required for hundreds of enzyme reactions. It plays roles in immune function, protein and DNA synthesis, wound healing, cell signaling, and division. And because of its many functions, zinc deficiency can affect the skin, bones, and our digestive and central nervous systems. The recommended daily intake is 11 milligrams. And the richest food sources of zinc include meat, fish, and seafood. Most people consume enough zinc from their diet, but for older adults, it can be a bit marginal, particularly in vegetarians and vegans, because they often eat large amounts of legumes and whole grains, which contain phytates that bind zinc and inhibit its absorption. Furthermore, we know from a 2019 meta-analysis that having enough zinc can help improve blood sugar level control. So, just like vitamin B12, it is important to reach your recommended daily intake. However, unlike vitamin B12, there are real risks from megadosing zinc. It can cause nausea, dizziness, headaches, gastric distress, vomiting, and loss of appetite. It also interferes with copper absorption, which creates its own set of problems over time. It is perfectly fine to use a low-dose zinc supplement to reach your recommended daily intake. But megadosing zinc can at best be wasteful, and at worst be genuinely harmful. Number 7 is probiotics. Probiotics are a collection of live microorganisms, primarily bacteria and yeast, that are encapsulated and taken as a supplement. The theory goes that our digestive tract is colonized with billions of microorganisms having complex interactions with our immune system. And there might be certain strains of bacteria and yeast that are associated with health benefits. The trouble is, many commercial products containing probiotics have not been examined in research studies. And the probiotics that have been studied have yielded mixed results. For example, a Cochrane review of 39 separate randomized controlled trials looking at eczema showed there were no clinically meaningful differences from probiotic supplements. A 2020 systematic review from the American Gastroenterological Association included 12 trials, and overall, the results provided no evidence that probiotic supplements help with Crohn's disease. The clinical guidelines conclude that evidence remains unconvincing for the benefits of probiotics for treating irritable bowel syndrome. And there is a practical problem beyond the research. Most of the probiotics you can buy over the counter, the bacteria and yeast, have already died because they are not properly stored, or they are not properly encapsulated. So they are broken down in stomach acid before reaching the gut. Until we have more research figuring out exactly which bacteria and yeast strains are beneficial, and for which patients the research suggests that probiotics are the second out of the 4 wasteful supplements. We simply do not know enough yet, and it is highly likely that if this area of research is eventually successful, we will need to personalize the therapy to the individual. Once again, it is your health and your decision. I am just here to deliver the research. Number 6 on the list is vitamin C. Vitamin C is required for the synthesis of collagen, carnitine, and certain neurotransmitters. It is also crucial for protein metabolism, and it is an important antioxidant. The recommended daily intake is 90 milligrams, and it is highly unusual to have low vitamin C levels, particularly because at daily intakes of 100 milligrams or higher, our cells become saturated. They do not need any more vitamin C, and they simply get rid of the rest. So, megadosing vitamin C is not expected to offer any further benefits because the cells will simply excrete that excess. But there are potential harms of megadosing vitamin C that I need to share with you clearly. A Cochrane review showed that vitamin C supplements do not reduce the chance of developing the common cold. Multiple studies have shown no benefits for cardiovascular disease, cancer, or mortality rates. And high-dose intravenous vitamin C actually worsened the health of intensive care patients. But one of the biggest problems with vitamin C supplements, and this is particularly important for active older adults, is that it blunts the positive effects of exercise. When we exercise, we generate oxidative stress, and that is actually a good thing. It signals to our body that it needs to become more efficient. So if we take antioxidant supplements, such as high-dose vitamin C, we blunt that oxidative stress signal to our cells. And we can see from randomized controlled trials that vitamin C supplements can diminish the training-induced adaptations within skeletal muscle. For anyone exercising to maintain strength and cardiovascular fitness after 60, which I strongly encourage, high-dose vitamin C supplementation may be actively working against your progress. That is the third out of the four wasteful supplements, and it carries a significant risk of harm for active people. Number 5 is multivitamin and mineral supplements. And here, I want to make an important distinction because not all multivitamins are created equal, and the research points in a genuinely nuanced direction. Like I mentioned earlier, it is important to reach your recommended daily intakes without megadosing, and we can see real benefits from this. A 3-year, randomized controlled trial involving over 2,000 patients found that daily multivitamin supplementation resulted in a statistically significant benefit on global cognition compared to placebo. That is a meaningful finding, particularly for older adults concerned about maintaining mental sharpness. But I want to emphasize this clearly. Megadosing is not a good idea. Think back to the vitamin C section. The goal of a multivitamin supplement should be to fill nutritional gaps in an otherwise good diet, helping you reach your recommended daily intakes across a range of vitamins and minerals without dramatically exceeding established targets. A well-designed, appropriately dosed multivitamin is a reasonable addition to a healthy diet for most older adults. The key words are appropriately dosed. The fourth most popular supplement is CoQ10. CoQ10 is known for its antioxidant properties, particularly within the mitochondria. Our cells can actually produce their own CoQ10 naturally, and a large number of studies have been done looking to see if there are additional benefits from supplementing with it. The bottom line, no benefit has been seen in treating cancer. It does not appear to prevent heart disease or have a clinically meaningful effect on blood pressure. Studies looking at early Parkinson's disease have shown no benefits from CoQ10 supplements, and one frequently cited rationale for CoQ10 that it helps patients who take statin medications manage muscle-related side effects has not been supported by the available research. Taking all of that research together, CoQ10 is the fourth out of the four wasteful supplements on this list, but now the next three are genuinely worthwhile, and I want to spend proper time on each one. Starting with number 3, omega-3 fatty acids. We have talked about omega-3 in other videos on this channel, but just to give a very clear summary here, the evidence for omega-3 supplementation, particularly for cardiovascular health, is among the strongest of any supplement category we are discussing today. A landmark study called the VITAL trial showed an unexpectedly significant 28% reduction in the risk of heart attacks in the group taking omega-3. A Mayo Clinic meta-analysis showed a statistically significant reduction in heart attack risk with high-grade certainty. Beyond cardiovascular health, omega-3 fatty acids reduce systemic inflammation throughout the body, support brain health and cognitive function, and play a documented role in reducing retinal inflammation and supporting tear production. For older adults dealing with dry eyes, joint inflammation, or cardiovascular risk factors, omega-3 supplementation addresses multiple systems simultaneously. The evidence here is genuine, consistent, and clinically meaningful. For most adults over 60, omega-3 supplementation is worth a serious conversation with your doctor. The second most popular supplement is magnesium. Magnesium is crucial for over 300 reactions in the body, including protein synthesis, muscle and nerve function, blood glucose control, and blood pressure regulation. The recommended daily intake is 420 milligrams. And here is the problem. Dietary surveys of people consistently show that many adults consume less than the recommended daily amount of magnesium from food alone. This is not a minor deficiency affecting a small group. This is a widespread nutritional gap affecting a very large proportion of the population, often without any obvious symptoms, until the deficiency becomes significant. For older adults, specifically, the consequences of inadequate magnesium are particularly wide-ranging. Bladder muscle reactivity increases when magnesium is low, because magnesium is the mineral that regulates muscle relaxation. And the bladder is a muscle. Sleep disruption occurs because magnesium is essential for GABA production, the neurotransmitter the brain uses to enter and maintain deep sleep. Blood pressure regulation, blood sugar control, and muscle cramping are all directly connected to magnesium status. Of all the supplements on this list, magnesium is the one I find myself discussing most consistently with patients over 60. Because the deficiency is common, the consequences are significant, and the solution is both straightforward and affordable. The form matters. Magnesium glycinate is among the most well-absorbed and is gentle on the digestive system. Magnesium taurate is another well-absorbed option that additionally provides the amino acid taurine, which in recent research has shown interesting longevity-related properties. Supplementing with magnesium to reach recommended daily intakes is one of the most well-supported recommendations I can make for most adults over 60. And the most popular supplement of all, number 1, is vitamin D. Vitamin D is primarily obtained from sun exposure. It promotes calcium absorption in the gut and helps maintain adequate blood calcium and phosphate levels. Without sufficient vitamin D, bones can become thin and brittle. It also plays important roles in neuromuscular function, immune function, and glucose metabolism. Here is the reality that makes vitamin D so important to discuss carefully and honestly. It is estimated that 50% of the population has vitamin D insufficiency, largely because modern life involves spending the majority of time indoors, working, resting, and spending leisure time away from natural sunlight. The recommended daily intake is 600 international units, and this recommendation is based on the assumption that a person is not getting adequate sunlight. So, taking an appropriately dosed vitamin D supplement to reach recommended daily intakes appears to be a sensible approach for most adults with limited sun exposure. However, and this is where I need to be very direct with you, megadosing vitamin D, which is what the majority of commercially available vitamin D supplements encourage, is not supported by the research, and it carries documented risks. A meta-analysis of 11 randomized controlled trials found that megadosing vitamin D offered no benefits in preventing fractures. Good evidence shows it does not reduce falls, does not improve muscle function, and does not reduce rates of cardiovascular disease, cancer, depression, or type 2 diabetes. The risks of megadosing vitamin D are real. It raises blood calcium levels, which can lead to nausea, vomiting, muscle weakness, pain, loss of appetite, excessive thirst, and kidney stones. And there is also good evidence that megadosing vitamin D can actually reduce bone mineral density, potentially weakening the very bones it is supposed to protect. The practical guidance is clear. A supplement providing approximately 1,000 international units of vitamin D daily is sufficient for most adults to maintain adequate levels. There is no evidence-based reason to exceed this without documented deficiency confirmed by blood testing and guidance from your doctor. This is exactly why no major medical guideline recommends routine vitamin D blood testing as a screening tool for the general population, because a modest, appropriately dosed supplement provides all the available benefit without the risks that come with the high-dose products dominating pharmacy shelves. Now, the counter-argument that always comes up is that you need to pair vitamin D with vitamin K2 and magnesium. But my overall point remains the same. We lack human research showing added benefit from this combination beyond what an appropriately dosed supplement alone provides. And I want to emphasize this because it always generates discussion. You are absolutely free to take any supplement you choose and pay for any test you want. I am only here to present the human clinical research and the established medical guidelines. Let me bring everything together now. The 4 supplements that the current research suggests are wasteful for otherwise healthy adults. Curcumin for anything other than osteoarthritis. Probiotics until the science matures significantly. High dose, vitamin C, and CoQ10, the 3 supplements genuinely worth consideration. Omega-3 for cardiovascular and systemic health. Magnesium for the majority of older adults who are likely not meeting daily requirements through diet alone. And vitamin D at a modest, appropriate dose for those with limited sun exposure. And the supplements worth considering for specific situations: vitamin B12 for older adults, those on metformin or proton pump inhibitors, or those eating limited animal products. Zinc at appropriate doses to meet recommended daily intake without megadosing. And a well-designed, appropriately dosed multivitamin to fill nutritional gaps without exceeding established targets. The overarching principle that runs through every one of these conclusions is this: reaching your recommended daily intake of essential vitamins and minerals through a good diet first, and targeted supplementation where genuinely needed is beneficial. Megadosing any vitamin or mineral based on social media trends or aggressive marketing is at best wasteful and at worst harmful. Your health deserves decisions based on evidence, not on what is trending online or what influencers are promoting. If this video gave you something genuinely useful today, please subscribe if you have not already. I create practical, evidence-based senior health content every single week. And please share this with someone you care about who is spending money on supplements without knowing what the research actually shows. Tell me in the comments which supplements on this list surprised you most, and which ones are you going to reconsider after today. I read every single comment, and your experience helps this community make better informed decisions together. Take good care of yourselves. I am Dr. Nyra Harrison, and I will see you in the next one.